Well, I think the consent is the critical discussion, but it's not the document that's so important. It's sort of looking the patient in the eye and having that discussion, and in particular tailoring that discussion to them, because they're not going to believe. Let's say, for example, the patient has an epiretinal membrane, and after the surgery, then you bring up the idea of the epiretinal membrane. Then you bring up the idea that the macular edema comes from that. They're not going to believe that epiretinal membrane was there before the surgery. So the whole key is to document in discussion that there may be some special situations in their case that are different. And then, of course, there's the broad sort of set of things that can happen. They're not going to remember much of the details of that discussion, so you have to be very sort of concrete about it. Like, you have a cornea problem that might lead to issues. You have a retinal problem that might lead to issues. You have the general issues, like 1% of the time people with cataract surgery do worse afterwards than before. And then you just sit there and watch and say, is this person following me? Do they want more detail, less detail? And then you sort of go from there. So I think there's 3 phases of that discussion. Phase number 1 is during surgery. You just have to mention that there's going to be it's going to take a little longer. We're using some special equipment, but we're going to take good care of you. There's a second phase. That phase is right after surgery in the recovery area, and you're talking to them about the fact that they had a problem, that you're working on the problem. You apologize that it happened, but you're with them, and you're going to take them through it. And then the third phase, which is equally important, is maybe you've referred them to a retina specialist. You're staying with them. You're calling them. You're emailing them. You're saying, how's it going? How are you doing? You're still helping them through this incredibly complex process of our medical system.